Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness. And today I have Miss Allison with me.
Hello.
And we are going to show you one of our new little fun toys, and it's called the Visia. So what the Visia does, now if you've been in here before, you know that we've had the reveal. And the reveal shows all the ugly I call it the ugly photos. So it shows everything underneath your skin, you know, the brown spots, the redness, it shows your sun damage and all of that. And so what the Visia does is it's like a step up from the reveal. So it's super exciting because it can show fine lines and wrinkles, it can show pore size, it can show...
I've got a list.
Oh good,
actually.
show us all the things
So
that it can show.
it's going to show spots, wrinkles, texture, pores, UV spots, brown spots, red areas, and porphyrins.
And the porphyrins are the bacteria
on the skin.
So that's pretty cool. So I've not had it done yet. So we are going to walk you through what happens when you come into the office. And the first step's going to be washing my face. But I'm going to also tell you, I'm going to go this way. This is the Visia. But then when you come in here, we take Canon photos as well. So we're not going to do those today, but I just wanted to tell you a little bit about those. So when you're in a medical setting, which this is, it is very important for us to give you results. We don't want you coming in here spending money on things that aren't going to make a difference with making healthy skin. So we like to document all of this. It's basically documenting in your medical chart. This is a medical clinic, and we want to make sure that everything is done the right way. So it's when you come in, you take your Canon photos, which means just regular photos, and we take frontal views, side views, face down views, so that the next time you come in, when we take them again, we can compare them. So the Canons are just your regular, you know, looking at your skin. We can tell the texture of your skin, the color, but we can't see underneath the skin. So that's where the Visia comes in. So to me, this is an excellent way to monitor your skincare, to monitor your fillers, your Botox, your secret, you know, your microneedling. Everything that we're going to do for you, we can monitor it. And I think that is extremely important. Photos are so important. I'll tell you, it's probably one of the things, not that people complain that much, but if they're gonna complain, they complain about how many photos we take. But remember, we're trying to document the changes in your skin, because when you see the first month, or you know, your standard photo, and then 3 months later and you see the change, you're like, wow, I really am spending money where I should be because I'm seeing results. And again, that is what we want. So I'm gonna go back over here, to the table, and I'm gonna put my hair up so that we can get everything out of the way. And she's gonna wash my face. So when you come into the office, it might be more beneficial for you just to come with a clean face. I completely forgot this morning, so I went ahead and just got ready because we had our meetings. And really, when you come in, if you come in with a clean face, it just saves you a little bit of time. But it's okay if you have your makeup on, if it's the middle of the day and you had to go to work or, you know, anything, it's totally fine. This is why we have a table in here so that we can wash the face. And we want to make sure that we get everything out. So even if you have a moisturizer on, just a moisturizer, or your sunscreen, because you're such a good patient and you put your sunscreen on, you want to make sure that you have a very, very clean face, because you're going to be able to compare the photos a lot better. So I'm having her go ahead and take off my eye makeup and my mascara, because you can look at your lashes on this Visia and we can compare. Now I do use Latisse, so it'll be interesting to see. I've not been great about it the last month probably, so it'll be interesting to see what my lashes actually look like. But what we can do is we can monitor, if you do add Latisse to your routine, we'll be able to monitor how many lashes you have, how thick they are, and how long they are. So I think that's pretty cool. Again, this is a newer thing for us because the reveal did not do that. What else for washing face? I mean, it's pretty basic, but...
Yeah, pretty basic. Like you were saying, if you can come without makeup, that does take away from a step, but people usually like getting their face cleansed, just kind of relaxing, and everyone always says it feels better whenever someone else does it for you.
That is true. So I'm glad that I put my makeup on.
Yeah.
And when I say makeup, I put on my my Even Up, which is Color Science, and I put on the Beauty on the Go and my mascara is also Color Science. And the reason I use Color Science is because it's all natural, it's mineral, and it's the sunscreen is physical, so it's zinc oxide and titanium dioxide. And if we have time at the end of the video, I'll just go ahead and put my routine back on, because I think it's really a simple routine, and I think that it's very beneficial for you to see. Ready?
Yeah, I'm ready.
Okay.
So whenever we come over to the Visia, we just let you have a seat here. And the reveal, we actually used to have to move the patient whenever we did the reveal. The Visia is great because now this machine will move for you. So you just have to place your chin on the pad. I like to wipe it down before each new patient.
One of the really cool things that this does is it tells your actual skin age. Oh yeah, my little black thing. It tells the skin, the true skin age. So I'm a little nervous because I have not done this yet. So we're gonna see.
We're gonna see what your real skin age is.
Yes.
And then if there's any little hairs sticking out, I like to just tuck these all back. So we're really just focusing on the face. Okay, if you've already been a patient with us and you have a profile in here, then it's been transferred over, so we don't have to create a new profile for you.
You have to put my date of birth in there?
Not whenever you look it up.
But the thing about the reveal of the Visia, unfortunately, we can't compare the photos because the Visia is such a more intense model. It's very updated, so it's unfortunate that we really can't see the change between the reveal and the Visia. So we're really starting over with everybody. Now we can compare them, but the Visia is so much brighter,
right?
And we can show you what I'm talking about. But so it's a little bit. It's going to take some time to build up the photos again.
11,
24.
24.
Yeah.
Okay, that was my second guess. Yeah. And date 02.
Oh, I'm telling all my secrets now. Okay, so it just takes you just a couple seconds to get the information in.
And it needs to know your date of birth for this so it can compare your real age to your true skin age. So that's an important part of this step, and it just takes a minute. Oh. And then you're just going to lightly place your chin on the pad, and you'll lean your head forward until it touches those to your head. Perfect. Bear with me one moment. It's a lot brighter than the reveal, so there's going to be some very bright flashes here. Just keep your eyes closed for me. That's perfect, and then I'm going to move this over to your left. Keep those eyes closed. Here we go. Perfect. Stay right there.
It's nice that they don't have to move.
It is nice. Yeah, you just look straight ahead and I do the rest for you. Okay, your last set. Perfect. Okay, so I'm going to take this off. You have to keep wearing that.
Okay.
And then we're going to review your results. Now, it does take a little bit longer to analyze everything than the reveal did, but that's because there's so much more information and data that it's gathering. Woo. So it does take a moment here to load.
And truly, we probably should have taken my earrings out. And those are really awful photos. So, when you come in, be prepared.
And this is just, like I said, gathering information, analyzing all of your data. So it loads like that. Looks kind of funny. And it does take a minute.
You can see it pretty well?
Mm-hmm.
Okay, great. Looks like some kind of a mask of, I don't know, like...
Well, kind of like a face mask that you would put on.
Yeah.
But at this time, for our patients, what I like to tell them is what they're about to experience. So while we're analyzing everything, I'll just tell them, so I'm going to go over these few categories with you, and it's actually going to give you a percentage of your category. And the percentage means if you're above 50%, you're above average for other women your age with your skin type. And then if you're below 50%, obviously you're below average for your skin type and age. And like we already told you, there's spots, wrinkles, texture, pores, UV and brown spots, red spots, and bacteria. So there's a lot of different categories it's going to show.
And it's like I'm getting ready to take a test. I'm really nervous. I'm so scared.
Okay, so it's gathered everything. The first image we're going to look at is spots. And this little bubble here, that's actually like a magnifying bubble. So that's really going to zoom in and blow it up so you can see it very well. Now, what it's outlining for you, these are visible spots on the skin. So it's going to include brown spots, red spots, any spot that's going to be visible that's on the outer layer of the skin. Let's see, she told me I can click.
And since I have so much redness, I mean, that's probably mostly what's showing on up with me.
And then, I mean, later we can see exactly what each spot is here. So it's going to give her a percentage, and it says 65%, which is above average, which is great. So that means that out of 100 women your age with your skin type, your spots are 65% better than them, or better than 65 of them. And like I said, just outlining those. Is there anything you want to go over with this?
That's what you were just saying is a 65%. So we're looking for green. If it was lower, which I think my wrinkles are going to be lower, it's going to be in the red.
Right.
And then the score 33.
And yeah, that's what they were saying. That's the most important thing there is your score. So you want your score to be very, very low, but you want your percentile to be high. So I'll even read you what the percentile says. It says your percentile score of 65% means that out of every 100 women with your skin and your age, your skin is better than 65 of them.
Cool.
And it's going to say that for each different category.
Okay, but wrinkles, I'm seeing 40, so there's the red.
So wrinkles, this wrinkle mask is actually just showing on the forehead there.
Okay.
And then as we change to each side, then it will show under the eye.
Ooh, that's what I'm afraid of.
Yeah, for you, on the forehead here, the light green spots, almost just on the hairline for you, those are going to be fine lines. And then whenever we look at these darker green spots, those are going to be more of wrinkles. Do you want to look at each side?
Yeah, let's look at the side.
Oh, goodness. Okay, we'll start with the left side.
Look at how red my skin is.
Bear with
me.
me.
731. There you go.
Okay. You just have a lot of pictures in there. Okay.
Oh, okay, so that's
now
different.
that's showing you spots, but we're gonna go to wrinkles here, and that's what you were afraid of. Yes. So under the eyes, you do have more fine lines than deep wrinkles under the eye, which is good. But your percentile is 44%, so a little bit below average. You need to start doing thermi eye more.
That's right. What's interesting are I don't have very many dark green lines, but that's because of the Botox and of course skincare too. Right. So I would love for it to be able to do around the mouth or other spots, but we're just going with the eyes, which the eyes are that's the place that I really dislike the most on my face, and so I use Total Eye there. Yes. And so you're right, I need to do thermi or I need to do something else to help with those fine lines and wrinkles.
And then this is showing your other side, which is interesting.
Isn't that interesting? It's so much better.
So on your, what is this?
That's
your
my
right side, 76%.
Wow.
So you're above average on your right side, but below average on your left. So
how is that even possible?
Do you sleep on your left side?
You know what? I do sleep more on my left.
Yeah,
Isn't that interesting?
That can cause some more wrinkling.
Wow. So I really just need to do thermi on my left.
Yeah, and then sleep on your back.
And
Okay.
what we're talking about with Thermi is Thermi uses heat energy to tighten up the skin and help with fine lines and wrinkles. So we have Thermi's probably the best treatment we have for directly under the eyes.
Right.
And I did do 4 treatments, but 4 obviously is not enough. And it's interesting though, when you do look at this, it does look worse on that left side.
Yeah.
You can definitely see more lines underneath. That is really interesting.
Oh, that's very interesting. So now you know which is your good side.
That's right.
Next, we're going to move on to texture. And this is going to show you raised areas and depressed areas. So the yellow is going to be raised areas, and then the blue is depressed areas. So that's just showing the highs and lows of your skin, that textural issue. Above average, which is great. You're at 75% better
Yay.
than most women your age. And it's always interesting to see these patterns because everyone is so different. And it's like right in the middle of your forehead there. I don't know if that's where you get product on perfectly when you're applying or what, but you can see the middle of your forehead looks great. And then as we kind of drag out around the outline, then it kind of becomes a little bit worse.
That is interesting.
Next, we will move on to pores. And you're at 87% for pores. So these little tiny circles, if you want to zoom in stuff, that's actually outlining enlarged pores on your skin. Now, most people are going to have the majority on their forehead and their nose there, but of course you can have some of those enlarged pores on your cheeks as well.
So in other people's photos that you've been doing, since we've only been doing this a little bit, are the dots bigger? Or the dots are the same, it's just more intense, like more of them.
Exactly.
Okay.
So you see how there are like some little clusters here and there. That's what it's going to look like if you have more there.
Okay.
It's not like the circle becomes bigger, even though I do see like a slightly bigger circle there. I think that just might be like a cluster of them.
Okay.
So
in the green again.
in the green again,
Yep,
very
uh-oh.
good.
This doesn't look good.
This one is UV spots. So you are at 43% for your UV spots, and this is actually showing under the surface of your skin, brown and red areas again.
Okay.
So anything that was just caused by the sun. And then we even categorize it into brown and red areas so you can see the different colors.
So I'm guessing it's probably more red since I have such redness, but let's see. Let's see what
yeah,
it is.
you're right. So your brown spots are at 79, so pretty above average there for you.
So why do you think that's true?
You wear your sunscreen
I do.
every day of the year and you reapply.
And the Even Up though, that's
yeah.
what I wear every single day, and the Even Up helps to treat brown spots. So this is super exciting.
I mean, just a little bit on your forehead and then over your cheeks and nose. And then when we get into the lower face, really looks good down there. Now, like I said, 79% for your brown spots, but then when you get to red areas, that's where you struggle a little bit more, and you're at 50%.
Right.
So still above average, right at that line there, but you do have like sensitive skin and irritation often. So.
Right. So a few things. I mean, I probably should be using All Calm,
Right.
Because that'll help. Or our Pep Up helps with redness. The Lightera and the HA5 can help with that too. So I probably just need to be more diligent with using some of the other products. But I have been having such sensitivities, which is obvious here. That I'm being a minimalist. And I think that's important to know that when you're talking products, you can be a minimalist and still have great results, or you can be the one who wants to have every single product going on, that we offer. So right now I'm currently using Lumivive, which I think Lumivive is helping with my redness. But it is, it's helping the cells regenerate at night, and during the day it has blue light protection, so that could be why I'm at the 50% too. So what I'm anxious to see is obviously what's going to happen. We'll check it again in 3 months, and see, because I need to bump up my routine. But I love that this shows us so much information and points us in the right direction of what products we should be using.
Absolutely.
That's what's so cool about it. So.
And whenever you have a lower percentage, obviously we want to focus on those categories first and build those back up. And then the last thing we're going to look at, this is bacteria on the skin. And you're at 55%, so a little above average there for you. Now, our hydrofacial is the main thing that I'm thinking whenever it comes to bacteria, because it is doing a deep pore cleanse, so it's really cleansing the skin, but it also at the end has some LED light therapy. And I know those blue lights kill bacteria on the skin, so I think it would be interesting. We need to do maybe a study, do this, hit it with the blue light, and then do it again and see if that actually kills some of the bacteria and changes that percentage.
Let's do that today.
Let's do that.
I want a hydrofacial today. So we will report back to you later today and let you know what happens. Because I was thinking the exact same thing, that it has to be hydrofacial. You know, maybe some chemical peels routinely. I mean, anything that's going to help to exfoliate and turn over the skin cells would be what I would think would help to treat that. And I think people with oily skin have higher amounts of bacteria. And so All Calm would possibly be a product that could help that too.
Okay, great. Now, we can do an overview, and this is just going to show you each category. So that's nice, and that's something we can actually print out or we can send to you via email, so you have that at home and you can refer back to that. Now, if I change to the side view, this is what we really want to look at. And this was, the right side was your good side, right?
Yeah, let's do right side, yeah.
And this is going to show us doctor's true skin age.
I'm so nervous.
So fingers crossed.
I know, it better be good. I am so nervous.
Okay, so that's an overview, and okay, so here we go. We're gonna find out her true skin age.
Yes!
Woo!
Yay!
Could not be happier. So her actual age is 46, and her true skin age.
That's a secret too.
Her true age is 41.
Yay! This is so exciting. And it said that it was only plus or minus
10 years.
10 years. Okay. So I really need to improve upon this, people. I need to be in my 30s skin age.
Yeah.
So I was really nervous, if you couldn't tell. And don't be nervous when you come in, but it's really exciting. And so what the goal is obviously to have your true age a little bit younger than your actual age. So quit showing my age. It's a secret, people. So that's really neat.
Okay.
Do you want to do the
on?
left side and see what it does? Because maybe since we haven't, we're going to try the left side. Let's see what my true age is on my left side. And you know, your left side is your driving side. I'm in the office all the time, so it's not like I'm out driving. But for people who are, I don't know if you've ever seen the truck driver photo. Oh, look at that. So there is a difference. Which is still younger than my real age, but there is a difference. So that's interesting.
That's, quite interesting.
Yeah. So, and I think, like you said, it's because I sleep on it. But people who are maybe drug reps or, any kind of sales rep, and they're out there driving all the time, their left side is going to be worse if you're not putting your sunscreen on, if you're not treating it, if you're not reapplying. So our Sun Forgettable brush, which is a powder brush, can be left in the car, and you need to reapply that every 2 hours when you are out driving. So this shows, because I sleep on my left side mostly, and I flip around, but I really am mostly on my left side. That shows the big difference. So back sleepers, we need to be back sleepers.
Right.
So as you can see, you can get so much information. So turn that back to the right side.
Okay.
Let's do my eyelashes.
Okay. So this is a very cool feature that we didn't have on our old imager, and this is going to analyze the eyelashes. So if you are wanting to try Latisse, or if you've been on Latisse, this is going to give you those statistics for your eyelashes. So you are actually in the lowest percentile.
Oh, wow. So I need to get back on my Latisse.
Yes. So it looks like 3.4 is your average length, and that's millimeters.
Yeah, and I probably still have a little bit of mascara, so it's probably a little bit thick, which is, interesting that I'm at the lowest, even with a little bit of mascara, so that's pretty sad, people. So I've not been good about my Latisse lately. So what we'll do is I'll make sure that I'm doing it every day for the next 6 weeks, and then we'll check it again and see where we are.
Let's see if I can look at both of your lashes there, but I guess taking into consideration both eyes for you.
Right,
So,
right. Okay.
Let's move on, and that's comparing. So this is a 3D image of your skin, which is very neat. So give it a minute to load here. You can take this little box, scroll it over any area that you'd like. So say we want to look at Dr. Jacob's under eye area here.
Because that was the bad area.
Right.
So
that is going to zoom in, give you a 3D image of what the skin is looking like in that area.
I mean, look, you can see a little brown spot right there too.
Mm-hmm. Yeah. It's really defining all of those fine lines. You can turn it to the side, and then that's going to show you all those textural issues as well. You can kind of see the bumps. And whenever I was doing Nicole's image earlier, I could actually see it was thick on this side and then started to thin out. So yeah, it's definitely interesting. And then you can change the view to look at, this is a black and white image, so this will help to stand out, like you said, some of those darker spots around your eye.
Yeah, and the deeper lines.
Yeah. And then this rainbow image here, this is like a thermal image, and this is just showing you all those different levels of the skin as well. Give it a second. Do you remember what she was saying for each color?
I think the blue was the deeper, I think, and the red, I can't remember.
Yours okay. I know, they wrote it down for us, so okay. That one's taking.
Oh, there it goes.
There we go. So you can see all of the different like heights and texture of our skin there. So
great. Here's the 3D viewer displays a rotatable magnified blah 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 blah. Well, shoot. Yeah, it doesn't tell us exactly. So I
think you're correct. The blue is the deeper. The yellow is raised, and the red is inflammation.
Yeah.
Okay.
And it's still just fun to kind of look at it and see your skin from that angle.
Yeah.
Now the simulation.
Oh, this is another scary one.
This is going to show you as you age, and it's going to go up to younger and then down to older, and you can just watch as her skin starts to age. You can see the lines start to become a little deeper, and then those spots.
Especially in the older, watch this area. So we'll leave it on here for a second because it's a pretty neat tool.
And then...
So if you do absolutely nothing, if I were to stop all of my products, all of my treatments as I age, that's what's going to happen. And you can see the brown spots getting darker. You can see the wrinkles getting deeper. You can see the texture is uneven, the peaks and valleys. I mean, it's pretty. It's really awful if you really.
And then this only on your front view can you look at your aging booth.
Right. So if you again do nothing, we'll be able to see what I would look like. At I think 80 years old.
Up to 80 years old. So I'm gonna pull this back up here, but it's almost like one of those apps where it changes you and shows you as an elderly person, and it's it's neat to see how your skin just starts to cool down, gravity takes a toll, and everything just kind of starts to move downwards. So
right.
I'm gonna pull this back
and
up.
That's what we talk about all day long, is that if you understand what's going to happen as we age, we can slow that process down. So if you are, really have a deficit in your face, filler is going to just lift that back up, especially under the eyes and in this area. That's where you start to see the aging. And when people come in for filler, they'll point to their nasolabial folds and their marionettes and they'll say, this is what I want to fix. But really, if you think about it, if you're pulling this way, you're fixing this, you're fixing this, you're fixing this, and you're improving that jawline. So just watch when I do just a little bit of pull. Can you see that? Mm-hmm. So a little goes a long way. You might do.
Right in there. Watch right there. And then in there. Yep.
And so that's what I do to patients all day long when we're talking filler. So we're not trying to do this, we're not trying to give you a facelift, because that's not what it is. It's a liquid facelift, but it's not like a surgical facelift. So when you're lifting, it's just a very slight change. So patients are always afraid, well, I don't want to do too much. Well, we don't want you to do too much. We don't want you to walk out of here and look like, you had a surgical facelift. That's not the goal. The goal is to go 5 years younger, just to plump up, to look refreshed. So, okay, you have it?
Yeah, you're going to hate this. You're going to hate this.
Oh my gosh, this is awful.
So it's almost just like a little bitty.
No, that's terrible.
Let's pause it.
Oh no, let's not. This is horrendous. So this is why I do skincare, and this is
exactly. And that's what I have been telling all of my patients is this thing, it does not take into consideration treatments and products.
My gosh. If this isn't a testament as to what you need to do. Oh my gosh, just turn that off. That's awful.
So this is showing the pattern, just gonna ignore that, and this is showing the pattern of how her skin is going to age, and really just showing the downward motion that her skin is starting to
I think this is exactly what I was just talking about. Watch my nasolabial folds. Do you see how those are getting deeper as this picture is showing aging? This is not gonna happen. I mean, it's not gonna happen. Whatever needs to be done here, but I think that's really interesting to be able to see, because like you said, everything is going down and it's showing you what's happening. Mm-hmm. And here's the good news is I don't feel like my eyes are too droopy later in life. So that's about all. Everything else is awful. So what are my recommendations for so I don't look like that?
So we're not going to click the recommendations, but obviously doing your injectables, doing treatments in office, and then your skincare at home. If you have like a specific concern, like your such as your around the eyes, those fine lines and wrinkles, like we said, doing thermi, anything that's going to stimulate the collagen, and then products every single day at home is what's going to really make a difference with that. Now, we can view your graph as well.
Oh, there's more. There's more.
And this is really nice. Just again, another overview of all of those percentages. So you can see you are above average for most of these categories. It's just UV spots and wrinkles that we need to work on. And again, when we did the wrinkles, that was only showing around the eyes and the forehead. Right. So it's not really taking into consideration the whole surface of the skin.
I mean, the sad part, my pores are the best. I mean, I guess that's good. I guess I don't have acne. I mean, I guess I should be grateful, right? Yeah. So it'll be interesting to hear everybody else's reaction. We'll be down in treatment rooms, so we're going to hear screaming, we're going to hear excitement.
And it's pretty funny. Everyone that does this simulation, once they get to that like 70, 80-year-old age, they go, that's my mom, that's my dad. It's been really funny. I've had people who want to like take pictures of it, just send it to their kids.
I just had a patient, and he pulls out his camera and he goes, this is what I look like at 80. This is my dad. Yeah. Fix it. Do something.
So that's what you're going to experience with our new imager here.
What are some of these other, like, what's the relative bar? And, oh, that's kind of cool. So that's the same thing, and it tells you. And so actually this is interesting because we have this for our TNS recovery complex. Oh, really? When they compare TNS recovery to other growth factors, we have one of these, and most of the other growth factors are down in this level, which means that they're not doing anything. So we want to be up in the green, and we actually, again, want to be up in that higher. This is your average through here, so I'm above average there, and those are my pores. So let's look at the percentile curve. So this should be interesting because it should show, so it should show, here's where I land on these curves. So the median and then the normal is in there. So I'm in the normal, which is, I guess, good, but pros and cons. So let's see the curve 2. This is the first time we were actually looking at this, so this is really fun. So we still have to learn all of these. So it says median, normal range is blue, and then my score is in there. So I'm not really sure. we'll have to look at these again and see exactly, and then progress trend. So this will be interesting. I think this is going to be as we progress. So these are all my older photos, which they don't have that technology. So we're just starting fresh here. So that'll be really great to know that when we do our next one, and actually over the year, if you do multiple, you'll be able to see the trend, and hopefully, the more you do, the better your lines should be and your percentages should be. So this is pretty impressive. I mean, I really love this. And then we can pull up, she's just looking at all the different reports, so we can actually pull up a report and we can put your recommendations on there, and then we can...
this would be printing it out and giving you the report. You could do your true skin age or any of the categories, and then you can take that home to refer back to.
So this is pretty cool. So we offer this to all of our patients. So it's something that when you, this is cool. Oops. That's okay. So this is something that we offer. So I think that everybody needs to have this done. I think that we can have some fun with it, but we can also measure all of our results. And I think that's the most important thing, as I said at the beginning of the video. I mean, that's the absolute most important thing, is for you to see results if you're going to spend this kind of money. But let's go back, because you don't have to spend a lot of money. If you did a retinol and you did a sunscreen, you're going to see change. Maybe add a moisturizer to that. You're going to see change with your skin. So that's the beauty of coming in, having this done, and saying, you know what, I'm a minimalist. I just want to do 1 or 2 products, and we'll pick which product. So maybe it's Lumivive, maybe it's Pep Up, maybe it is just a retinol and a sunscreen. Again, it's dependent on what your issues are.
Absolutely.
So I think, how are we doing on time? Look at my phone there, because I was going to put, if we still have a little bit of time here.
We went over time.
We went over. I say we do it anyway. I mean, those that want to watch, are fine. But anything else with this that you can think of?
Nothing else with the Visia that I can think of, but again, this is showing the outer layer of your skin, and it's showing more of the dermis as well, which is the deeper layers of the skin. So it's going to give us a better idea of what's going on with your skin to give the best recommendations for products and treatments. So It's fun to play with, but it's also very educational and very informative too.
Extremely, and this is a service that we offer to all of our patients. That's how important I think that it is. I think that you need to be able to measure what's going on. So why don't we go into the Beauty Boutique, and we will, I will go ahead and put my aftercare, well, really it's my daily routine. So come on this way, and hopefully everything is out that we need. So I'm going to grab my recovery here, and then we don't have all the Skin Medica products. So I'm just going to put on the Pep Up today. So we're just going to go ahead, and this is probably why some areas. Would you mind just asking them to bring it down a bit? Yeah, thanks. Okay, so I got my Pep Up on, and we're going to bring it down onto the neck and to the chest. I'm going to let that dry for a second. Then I'm going to put my Total Eye on. So truly I would have put my Recovery Complex, my Lumivive, my Pep Up, and I don't feel like I need a moisturizer when I'm using the Pep Up. So we're going to go with that. So the Total Eye is going to go on next, and you can see that it has a little bit of color. So I'm just going to dab it on. The beauty of this is that we can put it on our upper lids too. So I'm getting coverage. It's going to cover the brown spots. It's going to cover any kind of redness and the dark circles, but it's also giving me an SPF 35. So I'm getting my sun protection. And it also has ingredients in that helps with fine lines and wrinkles. And this could be why, when we saw the photos that, my eyelids are actually pretty good. They weren't too bad. Underneath, on the one side was not so great. So that's that. We're gonna do some Even Up. With Even Up, I'm gonna warm it up in my hands before I put it on. I'm just gonna rub it in, get it everywhere. And this is an amazing product because just like I said with the Total Eye, it's a 3-in-1. So you're getting coverage. I use this as my makeup, really, all that I use, and as my base. And then you're getting the treatment of brown spots. So that's probably why my hyperpigmentation or the brown spots are really pretty darn good, because it might even up. And then you're getting an SPF 50 physical. And remember, physical is that it sits on top of the skin. So it's not being absorbed into the body. There's no harmful chemicals. There's no parabens, dyes, talc, any of the bad stuff. Now, I use the Beauty on the Go, which may not be in here. It is. So here's the Beauty on the Go. And I'm not going to put it on right now, but I use this as my inner. I use that as my outer. And I use this to blend it. And then I use this in the corners of the eyes. So it's really pretty cool. And I guess if I have the brushes, I can do it. Yeah, I have the brushes here.
I use that one as my blush.
Yes, I use it as my blush too. So like I said, so the pink, I'm going to put on the inside. Ready, like that. And then I'm going to go outside. And this also has an SPF. It's all mineral. There's no dyes, talc, parabens, I mean anything bad in there. And then I take this little brush and I blend it. Very good. And then I take this one and put it in the corners of my eyes. And it just brightens a little bit in there. And then I'll put a little on my brow out here to brighten that a little bit. Very good. And then, as you said, the blush. These are all Color Science brushes, and there's something fancy with the way they're made, and I don't remember exactly.
I think they are made to apply the mineral makeup the way the mineral makeup is supposed to be applied.
Yeah. I will use, let's see, I am...
Oh, sorry, we lost connection just for a little bit. No, we're
back.
back. We're back.
I am light ivory, so I'm going to use, is it dirty? So I just use a little bit of powder to blend it. So blend it all. Blend it, blend it, blend it. So you can see I don't really put much powder on. And then I'm going to spritz it with the hydrating mist. Oh, feels so good. And then mascara. Let's see, what color lips do I want to do today? So let's do
Down below.
Down below. Mascara, brush. Do I have any out? If not. Hang on. All right. So I love, thank you. Mm-hmm. I love the mascara because it thickens and it darkens, and so it makes the eyelashes look absolutely amazing. Plus there's no tar, again, no chemicals. So look at the difference, even though I still have a little bit on there, but look at the difference. I think it's pretty amazing.
It'd be cool to do a Visia before and after of wearing your mascara.
Yeah, we could try that. So many things to try. Really good. Set that one there. Take that, and then I'm going to get some lips. And the lips it's the SPF Shine. And I'm going to do pink today. Let's do it this way, actually. So the pink has SPF. All right, let's do this. There we go. Has SPF 35. And so you want to make sure that your lips are protected too. I should have grabbed mine out of my purse. So anyway, that was it. Very simple, very easy. I have my all my SkinMedica and my Color Science products on. I throw on all of my Color Science quote-unquote makeup for that SPF. That's giving me protection, but also giving me treatment. And that's it. So if you have any questions, please give us a call or leave messages, at Facebook. Steph's real good about answering those. And give us a call at 618-2889-117. Thanks.